I think that my department knows that during this COVID-19 pandemic, our population is going to be one of the hardest hit. I have patients on my unit where their biggest concern is where they're going to get their next hot meal. So the thought of them wearing a mask in public every day to protect themselves or protect other people was one of the last things on their minds. We work with patients that suffer from homelessness, marginally housed individuals, those that suffer from drug addiction, and those that are in a current psychiatric crisis. So to be a voice for a community that is constantly underserved and overlooked during a COVID-19 world is what truly drives me to go to work every single day. For the first few weeks, I felt really numb, as though I was in a dream. Believing that this was not real. The fear of death felt very near and real all of a sudden, and not just for our patients, but for me as well. Every day I left work, my mind revisited all the interactions I had that day. Did I wear my PPE properly? Did I wash my hands enough? Was I touching my face and not knowing it? And when I went home, it affected my relationship with my family. I was keeping a safe distance away from my husband, isolating myself from my daughter so that I wouldn't get her infected, because every day there was a fear of me passing it to my family. I think what I want people to know most in the city is that we need to make sure that we're using evidence to make decisions. My fear is that we release the shelter in place too soon and that we're going to see a spike and we're going to be at ground zero. So my advice for you guys is to stay home, stay safe, wash your hands, and remember to wear your mask when you're in public.